So hello and welcome everyone, and thank you for joining us at our Migration Policy Center webinar. As the title of today's webinar suggests, we will be talking about the impact of the COVID-19 pandemic on refugees and migrants. We are very pleased to welcome our speakers today. First, we will have Eugenio Cusumano, who is a Marie Curie Fellow at the Ca' Foscari in Venice and a visiting fellow at the European University Institute. His research in general is on migration across the Mediterranean. The second paper will be presented by Lorenzo Piccoli, who is a research fellow at the Migration Policy Center and leads the work of the MPC on teaching and training together with the School of Transnational Governance. His research focuses on the politics of inclusion and exclusion of mobile individuals from basic rights, such as healthcare and voting. And as the final speaker, we will have Eva Spiritus Berden, who is a PhD student at Ghent University in Belgium. Her research mainly focuses on identifying both risk and protective factors of the psychosocial well-being of refugees and migrants across the board, specifically during the COVID-19 pandemic. So for all of you who are following us on the YouTube channel, I encourage you to ask questions to the speakers. You can write them in the chat box. And without further ado, I now give the floor to Eugenio. So Eugenio, please.
Thanks, Lenka, for the kind introduction, and thanks everybody for attending. In my presentation, you should now be able to see from the slides, I will be focusing on the construction of irregular migration to Europe as a carrier of infectious diseases, and therefore as a threat to European citizens' public health. I believe that the narratives, the public narratives that underlie the securitization of migration are crucial to understand the making of migration and border enforcement policies that have crucial implications on migrants' safety and well-being. And therefore, I hope that my presentation can nicely pave the way to the talks by Lorenzo and Eva that will follow me, and to the discussion that we will have at the end of the presentation. Specifically, I will be showing you the result of a content analysis that I have conducted in order to gauge whether and to what extent migration to Europe, irregular migration to Europe, has been portrayed as a public health threat and as a source of the spread of infectious diseases. As you probably all already know, securitization is the process whereby a certain issue is socially constructed as an existential threat to a certain referent object like European societies and citizens. This process can occur either by speech acts, discursively, or by day-to-day routine practices. There have been various studies on the securitization of global health, as well as migration, which in fact has been explored, has been examined by a variety of scholars. There have also been some early research showing how COVID-19 and epidemic diseases in general have been used to legitimize restrictive border enforcement policies. But so far, there hasn't really been any systematic research examining the role of health discourses in presenting irregular migration as a threat. And it is this gap that the research that I will be presenting you today tries to fill. To this end, I will basically present you very briefly, because I do not have much time available, the results of a content analysis, a pretty large content analysis that I have conducted, which examines newspaper articles on irregular migration in Italy, Malta, and Spain. I will be examining newspapers at both ends of the political spectrum, but also embrace a fairly long longitudinal dimension, 2013 to 2020, in order to leverage both variants in the size of irregular migratory flows across the Mediterranean and the Atlantic, but also the occurrence of different health crises. The 2020 COVID-19 pandemic, of course, but also the Ebola pandemic that has spread across sub-Saharan Africa, in 2014. My analysis, as you will see in later, will focus both on text, coding some 5 million words, as well as images, because I will be coding, I will show you the coding of around 1,200 pictures as well. As far as the textual content analysis is concerned, I have departed from the conceptualization of securitization as a master frame, and therefore use frame analysis as my main methodology. Specifically, I am looking at the words, at the frequency of specific words in a certain context. Those words that do create what can be called associational links between the phenomenon of irregular migration as well as specific threats, such as infectious diseases, but also terrorism and organized crime. Here, I am basically following the assumption that has been made by several securitization scholars that the more the public encounters a particular discursive linkage, between a certain issue and a certain threat, the more validity then that connection assumes. So that tracking fluctuations in word frequency over time helps assess how securitization varies over time and across different countries and media outlets. As you saw, my slides themselves are eager to show you the results of the analysis. So without any further ado, let me show you what I have found out. As you can see, the discursive links between migrations and infectious diseases in the two Italian newspapers that I have examined, Il Giornale, a very conservative outlet, as well as the more progressive La Repubblica, show that we see an increase in the tendency to link migration and infectious disease already in 2014, in correspondence with the Ebola outbreak. The discursive linkage then decreases in intensity, but skyrockets after the COVID-19 outbreak in 2020. The same phenomenon can be found in Maltese media, where we see the exact identical pattern, a pattern that in fact is also reflected by the two Spanish media that I have examined. In each of these three cases, you see that there is a slightly more pronounced tendency to securitize migration as a public health threat in conservative media outlet, but this tendency can be found in progressive newspapers as well. But how does the tendency to securitize migration as a carrier of infected disease fare compared to other more often studied securitization frame, such as the connection between migration and terrorism, or migration and organized crime? Here you can see from my analysis of the relative prominence of different frames that as far as Italian newspapers are concerned, the tendency to portray migration as a harbinger of crime is more pronounced. But again, infectious diseases gained prominence in 2014. You can see an increase in the tendency to securitize migration as conducive to terrorism in 2015, 2016, in correspondence with the attacks in Paris, in Spain, and in Germany, as well as the rise of the Islamic State. But then in 2020, in correspondence with the COVID-19 outbreak, discursive linkages between migration and health risks gain widespread prominence. The same can be said when it comes to Maltese media, when in fact infected diseases tend to be more pronounced as a securitizing frame than terrorism, and in Spain as well. You can see from the textual content analysis, therefore, that while there has been a skyrocketing in the tendency to securitize migration as conducive to infectious diseases in 2020, unsurprisingly, in correspondence with the COVID-19 outbreak, these discourses pre-exist the latest coronavirus crisis. Let me now jump to the last and perhaps less conventional aspect of my analysis, the coding of the pictures that these newspapers have used to illustrate their coverage of irregular migration. The coding of pictures is less straightforward than the coding of text because pictures tend to be inherently polysemic. They can have multiple meanings depending on the viewers. I have tried to tackle this issue by, first of all, looking at the correspondence between text and pictures. These are the pictures that I use to illustrate articles on irregular migration. But also we have double coded, my research assistant and I, each of the picture, and included in the analysis only those pictures that were coded consistently. And last, we have chosen to focus on one objectively measurable item, the clothing and gear that border security forces wear in their interactions with migrants. The assumption we depart from here is what existing scholarship already noted, that is that face masks are assigned that connote refugees as carriers of diseases. And I have then examined whether face masks, as well as fully fledged biohazard suits or no protection, are present in the dress code, so to say, that border security forces wear when interacting with migrants. You can see here that there has been a growing tendency in Italy to have security forces portrayed wearing some form of biohazard protection, either complete or partial, starting from the 2014 Ebola crisis. And this tendency then becomes more prominent and wins the day in correspondence with the COVID-19 outbreak. In the case of Malta, you see that, in fact, biohazard suits are very prominent from the very outset, although they then become almost omnipresent after the COVID-19 crisis. A tendency that you can also see in the pictures that have been used by Spanish newspapers ABC and El Mundo in illustrating their coverage of irregular migration. So to summarize, while the scholarship on the securitization of migration so far has duly mentioned infecting diseases, it has also relegated health risk to a somewhat subsidiary role. By contrast, my analysis shows you that visual and textual linkages between migration and the risk associated with the spread of infected diseases have, of course, skyrocketed in European newspaper coverage after the COVID-19 outbreak, but were meaningful since at least 2014. They are widespread in both progressive and conservative newspapers, and tend, in fact, to be more prominent than discursive frames that are usually assumed to be especially relevant when it comes to the securitization of migration, like the linkage between irregular migration and terrorist attacks. The theoretical implications of these findings, I think, are several. I cannot elaborate on those at length, but let me just mention that the existing literature tend to argue that irregular migrants are framed as both a risk to European citizens, but also at risk because of the perilousness of their irregular journeys to Europe. As a result, in these discourses, we see that threat and vulnerability serve as coexisting notions. My analysis, by contrast, suggests that threat and vulnerability are, in fact, mutually reinforcing categories. In the context of global health crises such as the COVID-19 outbreak, migrants may be framed as a risk not despite their vulnerability, but precisely because the vulnerability that they experience in their home countries and in their irregular journeys to Europe may make their body ideal carriers of infective diseases. Another aspect that is perhaps worth highlighting is that border security practices, once used by media, become themselves an important discourse whereby migration is securitized. Therefore, these border security routines are not only important in and of themselves, but also because of their performative effect, also because of their contribution in framing migration as a potential harbinger of health threats. This, of course, has several policy implications as well, but perhaps I will leave those to the Q&A that will follow and leave the floor to my co-presenters. Thanks for listening and for having me.
Thank you, Eugenio, for this very interesting presentation. I encourage our viewers, if you have questions for Eugenio, of course, write them in the chat box and we will deal with them at the end of the other two presentations. And now, without further ado, I would like to give the floor to Lorenzo. So please, Lorenzo.
Thank you, Lenka. Thanks a lot. I will start my presentation as soon as Eugenio stops sharing the screen, going to the
Sorry
top
about
of
that.
the
As you
screen.
can see, my computer is a bit cranky today.
No worries. We have this strategy at the MPC of always creating some turbulence in the transition from one presenter to the other. So thanks a lot for being here. My presentation is entitled Citizenship in Times of Emergency, and I will try to jump right to the context of this research because I want to convey the idea that even though this is a very broad topic, it's also an important one to study and to analyze. And the context is that emergency situations enable governments, national governments, to take extraordinary measures and expand their role as providers of basic rights. We can see that, for example, in emergency cash transfers, evacuations of individuals, but also protective measures at the borders. Eugenio mentioned some of those measures, but we can also think of quarantine facilities or vaccination facilities in airports, in train stations, and borders more generally. We can also think of special hospitals, testing, and vaccination structures. And when we see all of those measures, we realize that they are driven by the urgency to protect the people. And one question that follows naturally, I think, for many in the audience is who are the people in question? So this is really the driving question for this piece of research, which focuses on the COVID-19 pandemic, but aims to answer more general questions on citizenship in times of emergency. And indeed, there is already some research available on the topic that starts to answer that question, suggesting that nationality or the formal status of citizenship has been used by government to discriminate against minority groups, including immigrant communities during the COVID-19 pandemic. Those are some articles that have been published in journals of sociology, political science, but also public health. And more generally, I think there is this assumption that during the pandemic, governments discriminated against migrant communities. And this piece of research really starts from a frustration with the evidence. So what I want to do is to try and go a little bit further than that and focus specifically on the legal provision of welfare, as opposed to public narratives, as Eugenio did, or, for example, on the actual socio-economic impact of the pandemic on migrants, as Eva will do in her presentation, and look at whether governments used the formal status of nationality, again, to discriminate against migrants when providing social rights, including healthcare rights, but also cash transfer. Now, this is too early to run a comprehensive empirical test. What I want to do, as written here, is to set a framework for comparative analysis. And the way in which I will do it is to pick some illustrative examples from different cases. So do not expect any fancy figure as you've seen in Eugenio's presentation and as you will see in EVAs, but I will try to make up for that with some colors. Before moving to that part of the presentation, I would like to tell you why this matters beyond the COVID-19 pandemic. And historically, we have seen that emergencies can lead to the introduction of services, of rights for individuals who were previously excluded from those rights. One famous example is the provision of electoral rights to US citizens who were abroad as a consequence of World War II. The Soldier Voting Act was introduced as a way to enable American soldiers to participate in elections during that specific emergency. Other emergencies like epidemics or pandemics were used in the past to trigger the expansion of social services for populations who were previously excluded, for example, from clean water supply and sewage systems. Here I put the case of London, but in many other cities in Europe that was the case. So emergencies in general can be used by governments to expand or to contract the provision of rights. And when we want to understand how those dynamics play out in the COVID-19 pandemic, I figure there is one way in which we can start, and that is collecting the reports that have been published by public institutions, but also by civil society organizations. And I collected 20 reports that track social policies during the COVID-19 pandemic. And for each policy, study whether it includes or it does not include different groups of migrants. So this is what we observe. And I created a continuum from more restrictive measures on the left hand of your screen to more inclusive measures on the right hand of your screen. And in theory, we can see that both directions are possible. So governments can either use the pandemic to include certain groups of non-nationals, or they can use the pandemic to exclude different groups of non-nationals. And indeed, if you look at the COVID-19 pandemic, we can find examples for each of those types. So let's zoom first into more inclusive responses. And that is the case, for example, of outreach campaigns that have been produced as a way of reaching out to asylum seekers and irregular migrants and include them in vaccination plans, but also in access to hospitals and sometimes emergency cash transfers. We can also look at cases where services have been expanded for the population. Famous cases are those of Ireland and Thailand that made social welfare available also for irregular migrants during the pandemic. And finally, facilitated status transition is a measure taken by a few governments as a way of allowing people who were previously irregular, as in Italy, to become regular migrants, or as in the French case, as a strategy to facilitate the naturalization of regular immigrants into French nationals after only 2 years of residence. So here, those examples show that the pandemic can trigger pragmatic approaches motivated really by selfish reasons, that is the protection of the whole population, but this results in more inclusive measures towards at least certain groups of non-nationals. There are also examples, and here we move on the other end of the continuum, of governments that took restrictive measures. And if we look at the examples that we know so far, those are mainly governments driven by populist concerns or objectives, where there was already sort of a democratic backsliding in place. And the pandemic was really used as an excuse to further marginalize and blame migrant communities. The examples are special cash transfers approved, excluding groups, large groups of migrant populations, famously in the US in 2020, but also in Brazil and in Hungary. And also a even more extreme case when non-nationals who try to access social welfare are even targeted, arrested, and in the case of the Philippines, deported abroad. So when we look at this image, we can see that the answer of governments can go both ways. What we can preliminarily observe is that the pandemic does not actually lead to a clear-cut return to protection for national citizens only, as it seems to be assumed by many people. Instead, for some governments, the pandemic actually gives strong reasons to expand certain services for non-nationals. And that seems to be in continuation with the trends of the recent past. So this is a strong argument for path dependency. Also, path-dependent approaches can be observed in those countries that were already engaged in restrictions and exclusions of migrants, mainly because of strongmen and leaders who are trying to weaken democratic institutions. So don't expect anything, any sudden change resulting from the pandemic. And instead, when it comes to the protection or the lack of protection of non-national groups, we can only see incremental change and adaptation. Of course, it remains to be seen whether those measures will actually last over time or whether they're only temporary and contingent to the pandemic, as it was the case, for example, with some of the regularization measures that were taken, notably in Italy and in Portugal. Of course, as I said, this is a very preliminary step and the general framework for further research on this topic. There are at least 3 ways in which we can better understand those dynamics. One is an empirical testing of different factors that can explain more inclusive or more restrictive responses across different countries, but also across different welfare policies. Think of vaccinations, and that may be different for hospitalization or special welfare relief. But we can also test whether there is change across different groups of non-nationals, such as asylum seekers, labor migrants, international students, irregular migrants. We would expect different approaches from regional and local governments than national governments. So that is something that could also be done, and this being done by some colleagues. And finally, the policies on paper that are approved by governments are not necessarily implemented as they are by street-level bureaucrats and by those who have to hand out welfare benefits on a day-to-day basis. So we can study and examine whether there are discriminatory approaches by those who are actually responsible for implementing the policies. I will finish by mentioning that this paper is part of a broader project on citizenship, migration, and mobility during the pandemic. So if you want, you can check out the website. And I do encourage you to get in touch to criticize this piece of research, but also to suggest further illustrations that can be used for it. Thank you very much. And I'll pass the floor back to Lenka.
Thank you very much, Lorenzo. Once again, a very interesting presentation and perfectly on time as well. So now, without further ado, I would like to give the floor to Eva. So Eva, please.
Hello, everyone. I hope you can see my screen now. I'm just going to close this. Okay, so good afternoon, everyone. My name is Eva Spiritusverde. I'm currently working as a PhD student at Ghent University in Belgium. And today I would like to talk to you a little bit more about our project called Apart Together, where we focus on the psychosocial impact of COVID-19 on refugees and migrants across the world. Sorry. So we know that since the beginning of 2020, the coronavirus has dominated the world and severely disrupted the daily lives of many. And while the impact of the pandemic on the general population has already been documented extensively, little is known about the specific impact on the refugee and migrant group. We know that the refugees and migrants' lives are often characterized by numerous stressors such as discrimination, poor living conditions, distress, as psychological distress, and this makes them especially vulnerable during the COVID-19 pandemic, as healthcare services and protective services are often overwhelmed and undercapacitated. So the current Apart Together research project therefore aims to assess the psychosocial impact of the COVID-19 pandemic. As it was for us, it was important to capture their concerns and experiences connected to COVID-19, to understand their vulnerabilities and to eventually make appropriate policy recommendations. And to do this, an online survey was rolled out that ran from April 2020 until November 2020 and was distributed across the world in 37 languages. This was made possible by a large European consortium and, as of June 2020, also the WHO. The survey consisted of 30 self-reporting questions that were mainly quantitative, but there was also the possibility for participants to voluntarily add stories of their own or give more explanation to some of the questions, which provided us with some additional qualitative data as well. By the end of November, over 30,000 respondents entered the survey, and these respondents currently live in 170 different countries and originated from 159 different countries. Participants could stop the survey at any time, so the number of respondents for each question varies a little bit and is usually a little less than 30,000. The survey asked questions about 5 different topics, which you can see here. Respondents were asked about their socio-demographics, their COVID-19 related health and behavior, their daily stressors, their mental health, and their social well-being. To recruit the respondents, a number of strategies were rolled out, such as a social media campaign, but also the use of a global network and local enumerators that help to increase the uptake of the survey. For the analysis, we started with some descriptive analysis first, and later on we did some more elaborate analysis as well, such as structural equation modeling. The first descriptive analysis of the survey showed that 55.5% of the respondents were male and 44.4% respondents were female. A handful of respondents were non-binary or trans. Here we can see indeed that most of the respondents were living in a house or apartment, and this is likely due to the online nature of the survey. However, a group of 300 participants for living on the streets or in insecure accommodations, or 600 for respondents living in refugee camps is still valuable to use in further analysis. And then we look at the results. So first, looking at the responses on the mental health items, we can see that the majority of the respondents reported a deterioration of their mental health on all aspects, especially regarding feelings of depression and anxiety, loneliness, and worries, where more than 50% of the respondents indicated them to be worse than before the pandemic. We also saw that 1 out of 4 respondents indicated that their substance use was worse than before. And overall, a higher percentage of women reported their mental health to be worse compared to men. And older respondents reported their mental health to be worse as well compared to respondents that were younger than the age of 20. Specifically, respondents that lost their job or were sent home without pay reported a high deterioration of their mental health. We see very clearly that there are respondents that are particularly at risk, as a high percentage in their group report a deterioration of mental health. These are the respondents that live on the streets or in insecure accommodations, and respondents living in asylum centers. Also respondents without documents or respondents with temporary residence documents, and respondents living in the African region reported a high impact on their mental health. Looking at specific worries, so we can see that their health is a big worry, either themselves or a loved one, and financial repercussions of the pandemic are a big worry as well. When looking at social well-being, we see that on average, respondents rate their social isolation almost 7 on a scale from 1 not at all to 10 extremely, and this is pretty high. When asking about their loss of connectedness, we see that respondents in more precarious situations suffer a lot more from a loss of connectedness. So respondents living in asylum centers and those that live on the streets. And it was also much worse for people without documents and permanent documents. Finally, between 13 and 27% of the respondents report experiences of discrimination to be worse than before the pandemic. And again, we can identify certain risk groups when it comes to experiences of discrimination, namely respondents between the ages of 20 and 30 years old, respondents that live on the streets or in insecure accommodations. And this is especially the case in the African region. Respondents that are unemployed or lost their jobs, and respondents without residence documents. Then in a recent study, we went a little further than the descriptive outcomes of the survey by looking at the role of daily stressors, such as access to housing, access to food, NGO support, etc., and perceived discrimination on refugee and migrant mental health. Since no standardized questionnaire was used, we conducted a exploratory and confirmatory factor analysis and on our proposed model, and found 2 factors for mental health, 3 factors for daily stressors, and 1 factor for discrimination. The first mental health factor we named anxiety and depression, which with items such as depression, anxiety, loneliness, and worry. And the second mental health factor was named hyperarousal, with items such as anger, hopelessness, sleep problems, and substance use. The results of the paper show that there was a significant effect of age, gender, residence status, housing situation, the 3 daily needs, and perceived discrimination on both factors of mental health during the COVID-19 pandemic. So again, respondents that are living in more precarious situations, for instance, respondents living in insecure accommodations, respondents living with insecure residence status, respondents that have their basic or medical needs less fulfilled, and respondents that experience more discrimination show significantly less mental well-being. Here, I wrapped up some of the conclusions. So in almost every case, we saw that there are groups that are increasingly at risk, which are undocumented migrants and refugees living on the streets or in insecure accommodations, migrants and refugees living in asylum centers or refugee camps, and migrants and refugees living in the African region. We saw that 22% of the refugees and migrants report that discrimination based on their origin has worsened since before the pandemic. And later on, we also saw that this had a specific effect on their mental health. And we also saw that over 50% of the respondents report access to work, safety, and financial means to be worse than before the pandemic. And later on, again, we saw that this was detrimental to their mental health. And we also saw that 60% of the refugees and migrants report more feelings of depression and worries since COVID-19, and more than 50% report to feel more anxious and lonelier. So the first results of the global study already provide us with very important information. The pandemic has had a detrimental effect on daily living conditions for all, but for certain groups of refugees and migrants, conditions have become even increasingly difficult, and therefore policy measures of the general population need to be wary of the conditions of refugees and migrants in order to prevent unequal outcomes. Moreover, efforts need to be taken to help improve the living conditions of the most vulnerable groups and to continue the provision of services also in times of the pandemic. Overall, it is important to strive for equity when it comes to the COVID-19 policy responses by including the most vulnerable groups in the conversation. To protect refugees and migrants, human rights and rights to health, measures are needed to increase refugees and migrants' access to multi-language information and to health services, both medical and psychological. So thank you for your attention. If there are any questions, I would be happy to answer them.
Thank you very much, Eva. So the questions are starting to come, and actually there is one for you. So maybe I will ask you already now, because one question asks whether the questionnaires and sampling methodology are available. So if you could answer that, please.
Yes, I think it would be I'm going to check. I'm not sure if it's online still, but I think if you contact me, I'll have to ask my supervisor, but it would be okay, I think, to send the questionnaire and the methodology used, but the data is not open for use.
Okay, thank you very much. So while I encourage our viewers to ask even more questions, there are already some. So our director, Andrew Geddes, the director of the Migration Policy Center, would like to ask Eugenio about the relationship between media coverage and issue salience. And what would you have to say about this? And there is another following questions to which I would also like to add mine, but I wait for your answer and then I add mine. Whether do we see also feeding in, how do we see this also feeding into attitudes to migration so that they become more negative, and political mobilizations that seek to use the migration disease issue? So Eugenio, the floor is yours, and then we proceed.
Thanks, and thanks, Andrew. Let me see if I can share my slides for another second in order to elaborate a little more about issue salience. My assumption when I started doing this research is that while there could be a more pronounced tendency to securitize migration as conducive to the spread of infected diseases, the salience of irregular migration as an issue in European newspapers would actually decrease. But let me see if I can now succeed in showing the slides, because once again, my computer is not really helping here. We see that there has actually not really been a decrease in the coverage that Italian newspapers, as well as Maltese and Spanish newspapers, have given, I finally managed, hopefully, to irregular migration over time. As you see, there are some fluctuations, but overall, in 2020, irregular migration has been given quite a lot of space in newspapers in Spain, Italy, and Malta as well. As of the second part of the question, or the second question, I'm actually myself fascinated by the connection between securitization and attitudes to migration, but have not yet been doing any research on this. So it would actually be very important, and that would be the natural follow-up step for my research, to see whether these securitizing moves that I have described to you have been successful in changing public attitude to migrations in European Union countries of first entry.
Thank you, Eugenio. So while we wait for more questions, so please do ask them. We still have quite a lot of time, so there will be time to answer them. I have a question that is kind of a follow-up to Andrew's one and to all of you, but maybe it fits the most to Lorenzo's research. So I would like to hear a little bit more about how the research you all presented today fits with the realization in many countries that migrants constitute essential workers. And that these were actually the people that were mostly out there helping the society in this time of crisis. So, for instance, although we did have Brexit in Great Britain, then also a lot of essential workers that were out there during the pandemic were migrants themselves. So how would you kind of fit all this realization into the research you presented today?
Thank you, Lenka. So I will start answering this question, and I'll keep it short. This was indeed a very important factor. If we look again at the regularizations in Italy, in France in particular, they were specifically geared towards non-nationals who served on the front line. That was the case in France, or regularization in Italy for irregular migrants employed in specific sectors such as the agriculture and domestic care. So for sure, the realization that many migrants are so-called essential workers did open a window of opportunity for governments to take more inclusive measures. Regularizations are quite extraordinary, as they were considered a taboo in European countries, at least for most of the last 10 years. We haven't seen any regularization program. However, that window of opportunity is probably closing already, since discussions on essential workers seem to be already out of the table.
Thank you. Maybe Eugenio and Eva could also elaborate a little bit on this. How does what you presented today fit with this kind of realization? How much essential migrant workers might be for the countries?
Okay, I can just comment very briefly. In my research design, I've tried to deliberately exclude regular migrants, migrant workers, migrants who are already in the territory of European Union countries, and focus on irregular migrants only, because those are the category of people that are most susceptible to being securitized. So as far as my analysis is concerned, there shouldn't be any influence of the realization, which is absolutely well taken, that in fact migrants are necessary in order for European societies to effectively cope with the COVID-19 crisis in the first place.
Yes, for us, it's the case that we included essential workers in the survey as well, but we did not link it to policy measures taken. So we did not look further into that yet. But as we do have the specific group, we could see what the effects were for their mental health, for their social well-being, for this specific group here. And it had some interesting results. I'm not entirely sure anymore what the numbers were, but we see that on some levels, as they were essential workers and still needed during the COVID-19 pandemic, the effects were different, and in some cases better than, for instance, people that live on the streets or in secure accommodations. So we did see that they were still needed, that they were still doing the job, but we are not sure how it relates to the policy or the government reaction towards these specific groups.
Thank you very much. And we also have another question for you, actually. The question asks whether do you think it is possible to compare your data with comparators of other population groups whose vulnerability may have been worsened by the pandemic? So this is a question again from Andrew. So if you could elaborate a little bit.
Yes, we will try to do more specific cases, and for instance, with the Rohingya refugees would be very interesting to see also respondents in the occupied Palestinian territory, just to see what for these specific cases was the effect. And it would also be nice to see what the policy measures of the specific country had to do with these impacts. But these are still plans, so none of that is yet 100% happening. But yeah, it would be very interesting to do this, and this is also one of our plans. I'm going to check the question again.
Yes, so it's basically whether you can also compare the responses that you received from the migrants or the refugees to other vulnerable group who might have faced some either health or mental health issues during the pandemic.
Yes, this is a very good idea, and it would certainly be something we could do in the future with our data.
Thank you. So now we also have a question. It is not addressed to anyone specifically. It is my feeling that it is mostly towards Lorenzo, but if anyone else wants to add something, please do. And I do feel that you a little bit answered this question during your presentation, but maybe you can just wrap it up a little bit. So the question is whether faced with the COVID-19 pandemic, how have states met the need for social protection of migrants and refugees, such as healthcare?
Well, it depends. So some governments, as I said in the presentation, took some inclusive measures out of selfish considerations, and for some groups of non-nationals, a few other countries clearly did not meet the minimum standard conditions, not only for irregular migrants, but also for asylum seekers. I think the main point is that policy responses really change, and I suggested one factor that can be used to explain that change, which is path dependency and the behavior of the government over the last few years, but there may be other reasons as well, and we will see more research on this topic.
Thank you. And just to follow up, there is also another question that I feel it's more towards you, Lorenzo. So Rima Merhi, I hope I'm pronouncing the name right, asks that, so she's saying, we have the worst refugee crisis in Lebanon, or together with an unprecedented financial crisis. How have outreach campaigns led to inclusion in practice, not in theory, if at all? If you could elaborate on that, please.
Yeah, I think that's an excellent question. So in my research, I don't look at the effects of policies, and I don't want to suggest that the policy answer of countries that are inclusive is necessarily better than the answer of countries that have been restrictive. Those are just the policies on paper. And then the effects of those policies can meet several obstacles, depending on the willingness of those who have to implement the policies, but also the actual capacities of governments, financial capacities, and other constraints. You give the example of Lebanon. I should also say the regularization in Italy is on paper something pretty special, but the results are extremely modest. I think only a few hundreds of individuals actually benefited from the regularization. So I want to make it very clear that we should distinguish between the intentions of governments, and what I try to show is that not all the governments necessarily take discriminatory policies when it comes to access to welfare during the pandemic, and the actual effects that may be very, very different. As you point out, that's the case in Lebanon.
And the same viewer also asked a question that I believe it's addressed to Eva, whether the survey also included Lebanon.
Yes, we also reached Lebanon, but only 34 respondents were currently living in Lebanon. So it's not that much.
Great, thank you. Now, just a new question came in for Lorenzo. Since you suggest that national residents are treated, I'm really sorry, now I lost it. Oh, it was retracted, so I'm really sorry. Meanwhile, so maybe we get it back before I manage to read it. So still we have quite a lot of time, so please ask any more questions. This is to our viewers, and meanwhile, while we wait for more questions, I also would like to ask you, the presenters, whether you actually have questions for one each other, because I think it was quite interesting how your presentation complemented each other. So maybe you also would like to ask your fellow presenters something. Not yet. Okay.
I can ask a question to Eva. So looking at the results, that was quite quick, but I seem to remember that people without documents were not as negatively affected in terms of mental effects as the people living in refugee camps. Can you confirm that's the case? And if so, perhaps elaborate on some of the reasons, because I would have expected that not having documents would really expose people to some of the most negative consequences of the pandemic from a mental perspective.
Yes, I'm not sure if do you point at something in the slides of numbers that you see, or the report of
in the slides there was one table with the regressions.
Okay, I'm going to check again. So sorry, yeah, I was checking the table. I'm not really sure about the difference. I'm sorry. So can I share my screen again?
Please do, yes.
So you talking about this table?
Yes.
So sorry, I have to check. So the question is whether respondents living in refugee camps are.
Yeah, I think there is a strong effect on anxiety and depression on people living in refugee camps in particular, while not having documents doesn't seem to.
Yes, sorry.
But no worries. I imagine the two can also complement each other. So you could probably live in a refugee camp and not have any documents. So it's not like one excludes the other. And I also imagine you have so much material already that it's pretty early to start digging in on those specific factors.
Yeah, but you're right. It's something that I haven't looked into, I think. It's been a while since I've checked this particular paper. But you're right, we should definitely look into that. And I think the first concern here was to see whether the effects on mental health were significant for the groups, and we did not look directly at the differences between the groups. So I think that's why I'm not sure about how to answer this question. But it would indeed be interesting to look at the differences between the groups as well.
So meanwhile, also the original question for Lorenzo came in. Lorenzo, since you suggest that national residents are treated differently than immigrant populations, do you think this amounts to discrimination? And if so, why? If it does amount to discrimination, under what legal test? Article 14, ECHR, for example, is the question.
Yeah, thanks for the question. I don't think that we can say that national residents are generally treated differently from immigrant populations. In some countries they have. In my view, in those countries where, again, strongmen were engaged in populist maneuvers that may have been discriminatory and due to political considerations to further concentrate powers in their hands. In other countries, it may have been because it's simply easier to reach out to those who are already in connection with the public authorities. So there may not have been a strategic or deliberate decision to exclude certain groups of non-nationals, but simply the resources were not there. Obvious examples, if we think of vaccinations, in a few countries, irregular migrants and even some groups of regular migrants have been excluded from vaccinations simply because they did not have the right document that was used by governments as a key really to access vaccinations. Again, this is not, I wouldn't think of that as a deliberate plan to discriminate against certain communities, but simply at administrative procedures that build on what exists already and what is available to governments. And unfortunately, sometimes those administrative procedures do not include certain groups of non-nationals.
Thank you very much. We also have another question which is not addressed to anyone in particular. I'm just going to read it, but if you feel you would like to answer, please do. So what is the level of application of the United Nations Convention on the Protection of the Rights of Migrant Workers in Europe? So maybe I feel like this might be more towards Lorenzo, but it is not addressed to anyone in particular.
It's difficult for me to say. What I know is that actually most of the signatories to the International Convention of migrant workers are outside of Europe. And I don't, as far as I know, the convention has not been used extensively to protect the rights of individuals during the pandemic. What we do know, however, is that those migrants who were regularly employed maintain the right to travel internationally and reach the destination of their employment. And in some cases, they were also able to travel back to the country where they hold nationality. So this is all what I can say on this question at this stage. I realize it's only a half-baked answer, but still something to start with.
Thank you. We now have a question to all the presenters, and maybe we give the floor to Eugenio, as I feel he has been quiet for a little bit. So do you think the COVID-19 pandemic has provided an opportunity to irregular migrants for reaching their desired destinations clandestinely?
No, I do not think so. We know that COVID-19 has mainly served as a migration disruptor. There were fears at the beginning that this would cause an upsurge in irregular migration to Europe, and this hasn't quite occurred. In fact, we have faced a decrease towards the beginning of the COVID-19 crisis. And then there has been a new moderate increase in migration across the Mediterranean over the second half of 2020 and the beginning of 2021. But this was due primarily to the deteriorating economic conditions of sending and transit countries in sub-Saharan Africa and the Maghreb region. But overall, there hasn't, I wouldn't say that traveling to Europe irregularly has become easier. In fact, it has become more dangerous, which is quite obvious if you look at the figures on the deadliness of irregular crossings, which has increased after the COVID-19 outbreak because of the restrictions on search and rescue operations that have followed the outbreak of March and April 2020.
Yes, thank you. I would actually subscribe to your answer a lot. So we have now another question for Lorenzo. Do you differentiate as to whether measures were temporary or not, and for how long they lasted?
Most of the measures that I discussed are, and I would say fairly surprisingly, temporary. So they had specific duration, usually actually for 2020, not even for 2021. And these sorts of contradicts what I said in the introduction of my presentation, that pandemics and other emergencies like wars and environmental disasters are important also because they have long-lasting effects on the distribution of rights. I would love to say that the pandemic had similar effects when it comes, especially when it comes to more inclusive measures. But to be honest, it doesn't seem to be the case at the moment. And as I said in answer to another question, the window of opportunity for introducing more inclusive measures towards non-national seems to be already closing.
And we also have another question for you, so I'm just going to read it out loud now. You mentioned restrictions on freedom of movement. Do you also consider local lockdowns or migrant reception centers, for instance, but not for the rest of the population in your data set? Do you think this points to a different treatment of migrants and nationals? How does this impact citizenship?
It does. So that would be a different paper. It is indeed a different paper that I'm writing, and other persons are working on the same topic. Travel restrictions are not really a part of what I discussed, but they are a very important component of the picture. You can already find more information on the website that I shared at the end of my presentation, and we will share it again now on the chat on YouTube, and the results there would be very different. So one thing is travel restrictions, and of course also all the discourse on the securitization of the borders that Eugenio is working on. And quite a different thing is the protection of the people who are already within the jurisdiction of the state. For sure, it would be interesting also in the future when more data becomes available to test whether answers, policy responses of the countries are consistent across those two dimensions. But for now, we don't have enough data, I'm afraid.
Thank you very much. So I believe we are reaching the end of our webinar. Thank you very much, all of you, for all of the speakers for presenting the research. Thank you very much for the questions to our viewers. And of course, I'm sure that all the presenters will be very happy to receive any more questions via mail, for example, about their presentations and about their research. So please do not hesitate to contact them in case you feel you would like to have a more thorough discussion that this webinar allowed to have. And otherwise, thank you very much for being part of this webinar. And I hope to see you all in our next webinar that we will have very soon. So thank you for your attention and goodbye.